Hello, my name is Samuel Rush. The purpose of this video is to demonstrate our airway management skills. These skills include the side lateral position, the triple airway manoeuvre, the insertion of an OPA, the insertion of an MPA, the use of a laryngoscope, assisted positive pressure ventilations with a bag valve mask. Dates of production include the 20th, the 26th and the 27th of September. In this video I'm going to demonstrate the lateral position. You position yourself at the patient's hips on your preferred side. You then maintain spinal cord alignment. You then place the arm closest to you across the patient's chest, the arm furthest away from you straight at a right angle. You then place the knee closest to you in flexion. You then quickly check the pockets to ensure that there's no sharp objects. This is a common mistake as people can get needle stick injuries. You then place your hands on the patient's shoulder and hips. You gently roll them away from you. Once they've rolled along to their side, you then place their leg at a 90-degree angle. You place their arm in front of their face and slightly extend their neck to allow free drainage of fluid. This is indicated in patients who are unconscious but breathing. In this video I'm going to demonstrate the triple airway manoeuvre, the head tilt, the chin lift, the jaw thrust. You start off by positioning yourself behind the patient's head. You then prepare the patient by placing a 2 to 5 centimetre cushion underneath the patient's head. You then place one hand on the patient's forehead with your thumb pointing towards the nose, and with the other hand you grab the patient's chin with your index finger and your thumb. You slightly place pressure on the forehead while simultaneously lifting the jaw. This brings the tongue off the patient's throat. That's known as the head tilt and the chin lift. With the jaw thrust, you place your thumbs on the zygomatic bones. The last 3 fingers you place on the angle of the mandible, and the index fingers on the body of the mandible. You then place pressure on the back of the angle of the mandible, protruding the jaw forward, opening the airway, bringing the tongue off the back of the patient's throat. Common mistakes include hyperextending the neck, causing the airway to obstruct. I'm going to be demonstrating the insertion of an OPA tube. You start off by positioning yourself behind the patient and preparing the patient. You do the triple airway manoeuvre and a manual airway clearance, just to make sure the airway is clear. You then select an OPA tube. You measure it from the corner of the patient's mouth to the angle of the jaw. Make sure it's correctly sized. You hold it by the flange, lubricate it with the patient's saliva, insert it halfway into the patient's mouth, and then rotate 180 degrees, resting the tip of the flange on the patient's lips. You then look, listen and feel for any air movement or a gag reflex. If there's a gag reflex, you remove the OPA tube straight away. This is indicated in patients who are unconscious or need a bite block for their ETT tube. Alright, I'm going to demonstrate this insertion of an MPA tube in an unconscious patient with trismus. You position yourself behind the patient's head. You then do a quick manual airway clearance as well as a triple airway manoeuvre. You then select an MPA tube, measuring it from the tip of the patient's nose to the patient's earlobe. You then observe the patient's nose for any obstructions or blockages. You then select the widest nostril, point the tip of the nose back. You insert the tip of the MPA tube towards the patient's eyes, wriggling it gently. If you feel any resistance, stop and remove it. Insert it to the pre-measured length. You then view the airway to see if there's any gagging, and then you look, listen and feel for any ventilations. Right, I'll be demonstrating the laryngoscope now. You start off by positioning yourself behind the patient's head. You then place something underneath the patient's head to help support the airway, and then apply a bit of pressure, a bit of extension to maintain the patient in the sniffing position. You place your laryngoscope on the left-hand side, your suction equipment on the right. You then grab your laryngoscope, placing it in your left hand, making sure that the light is white, tight and bright. You then place the laryngoscope in the patient's extreme right, observing the oropharynx as you enter the mouth. You then position the tip in the vernacular groove, slowly applying pressure away from the patient's mouth, ensuring that you don't place pressure on the teeth. You then observe the vocal cords, viewing them for any obstructions. If the patient starts to gag at any point, you remove the laryngoscope straight away. Alrighty. I'm going to be demonstrating the ventilation with a bag valve mask. You start off by positioning yourself behind the patient's head. You then prepare the patient by doing a triple airway manoeuvre. You then manually clear the airway. You then insert an OPA tube in correct size. Like that. then select the correct size mask, depending on whether a child or an adult. You hold the mask between your index finger and your thumb, applying pressure downwards with your index finger and your thumb, and using the bottom 3 fingers to maintain position and getting an adequate seal. You then inflate 10 mils per kilo, so it's approximately, for this guy, it'd be 500 mils. You ventilate at 12 to 16 ventilations per minute. Common errors include overinflating and that can damage the patient's lungs. Whilst ventilating, you look for rise and fall of the chest, ensuring that you have an adequate seal.